ever stop to think about the parts of animal health we rarely discuss?
Hmm.
Today, we're not focusing on the heart or the lungs, the usual suspects. We're taking a deep dive into a less talked about but incredibly important area, vaginal conditions in animals.
Yeah, it's definitely not dinner table conversation, is it? But these issues can really seriously impact their comfort, their ability to breed, and just their general health.
Exactly. And you've shared this really fascinating stack of sources with us that unpacks the world of vaginal malformations and acquired lesions in animals.
It really covers the gamut, doesn't it? Everything from things that go wrong way back, during embryonic development to problems that only show up later in life.
So think of this deep dive as your personal guide. Through all that material, we're pulling out the most vital nuggets of knowledge for you.
Right.
Our mission today is to help you understand what these different conditions are, maybe why they happen, how vets figure out what's going on.
And what can be done about them.
Yeah, what the options are. We'll be concentrating mainly on dogs and cattle because, well, that's where your sources really focus.
Hmm.
We're here to help you navigate the complexity and hopefully get a much clearer picture by the end.
Sounds good.
Okay, let's jump right in then. First off, what exactly are we defining as vaginal conditions in animals? It sounds like it could cover, well, quite a lot.
It does. It's really about any alteration to the normal structure or, the function of the vagina and the surrounding vulvar area.
Okay.
And we can broadly split them into two camps, sort of like you hinted at. They're born with, we call those congenital anomalies.
Right, congenital.
And those that develop over time, those are the acquired conditions.
So it's either a developmental thing from the get-go or something that happens later on.
Precisely. If it's congenital, it means something didn't form correctly during embryonic development. It's incredibly complex down there.
I bet.
The sources talk about structures like the Mullerian ducts. These are tubes that normally fuse together to form the uterus, cervix, and part of the vagina, and also the urogenital sinus.
Okay.
If that intricate process of fusion, canalization, forming the tubes, if it goes even slightly awry, you can end up with a malformation. Things just weren't built quite right from the start.
And the acquired conditions.
Yeah.
What triggers those?
Well, those happen after birth. They can be triggered by external factors like, say, injuries or foreign bodies, or internal things like infections, inflammation, maybe abnormal cell growth, like tumors.
Okay, and these sources you mentioned, they really zero in on dogs and cattle. Any particular reason why those species?
Well, they're very common domesticated animals, right? So these conditions are perhaps more frequently observed, diagnosed, and definitely reported in the kind of literature you provided.
Makes sense.
And understanding these issues is really crucial because they aren't just abstract problems. They can directly interfere with key biological functions.
Like breeding.
Exactly. They can prevent successful mating, make pregnancy difficult, or even physically block the birth canal, causing what we call dystocia, a complicated delivery.
Oh.
And beyond reproduction, they're a major cause of chronic, often painful issues like recurrent urinary tract infections or UTIs, persistent inflammation.
Vaginitis.
Yes, vaginitis. And even just the discomfort from discharge or skin irritation that significantly impacts an animal's quality of life.
Okay, let's start by looking at those conditions animals are born with, the congenital ones. Where do these developmental hiccups actually happen?
So as we touched on, it's all about errors during that really complex process in the embryo. Structures that should fuse together might not, or parts might be underdeveloped or just end up in the wrong spot.
Right, and the sources detail a few key types. One that seems to come up a lot is vaginal septa, bands, or stenosis. What exactly are those?
Okay, so think of these as internal dividers or narrowings within the vaginal canal. They're typically made of fibrous tissue.
Like a wall inside.
Kind of, yeah. They can range from thin, flimsy membranes to quite thick, tough bands. And they can partially or sometimes completely block the passageway.
Okay.
A really classic example that the sources highlight is a persistent hymen. Normally, the hymen is just a developmental remnant. It's completely gone by the time an animal is born.
Uh-huh.
If it sticks around or if it's imperforate, meaning it doesn't have a normal opening, it basically creates a physical barrier inside the vagina.
So what kind of problems does a barrier like that cause?
Oh,
Seems like it could get in the way.
it definitely can. Interestingly, sometimes they cause no obvious signs at all, especially if they're thin or only partially blocking things.
Oh, okay.
But if they're significant, they can be a really big deal. A major issue is that they can trap urine or normal vaginal secretions above the blockage.
Oh, I see. Pooling?
Exactly, pooling. And that leads to chronic vaginitis, recurrent UTIs,
Mm.
basically constant irritation and infection because stuff can't get out properly.
And for breeding animals?
Big problems there. A septum can make mating physically impossible. Or if they somehow manage to get pregnant, it can block the birth canal. That might mean needing a C-section or having a really difficult birth, that dystocia we mentioned.
Right.
Sometimes, if the blockage is pretty much complete, fluid just builds up and builds up behind it. That condition is called hydrocolpus.
That sounds serious.
Yeah.
How do vets actually find these septa or narrowings?
Well, the key diagnostic tool here is vaginoscopy.
Using a scope.
Exactly. It's essentially putting a small camera or a lighted scope inside to look directly at the vaginal walls. A physical exam might give a hint, and sometimes in larger animals like cattle, you might be able to feel bands during a manual internal exam.
Yuck.
Imaging is also really important, particularly something called contrast vaginography.
Contrast.
Yeah.
So using dye.
Yeah. You inject a safe dye into the vagina and then take x-rays. It basically outlines the whole vaginal tract so any internal blockages, narrowings, or weird shapes show up really clearly.
Clever. And what's the treatment? Can they be fixed?
Often, yes. For thinner septa or those persistent hymens, sometimes they can be broken down manually by the vet or removed surgically using instruments passed through the vaginoscopy scope.
Okay.
More substantial, thicker, fibrous septa usually need more formal surgery to cut them out. Sometimes the vet might need to perform an episiotomy, that's a small, temporary cut made to widen the vulvar opening just to get better access for the surgery.
Gotcha. Another congenital issue mentioned is rectovaginal fistula and anovulvar cleft. Now, that sounds like things are connected that definitely shouldn't be.
That's exactly what it is. A fistula is an abnormal tunnel or connection, in this case between the rectum or the anus and the vagina or vulva.
Wow.
An anovulvar cleft is sort of a variation where the anus essentially opens into the vulva instead of having its own separate opening. And these are often seen alongside another condition called atresia ani.
Which is?
Atresia ani means the animal is born without a normal anal opening altogether.
Okay, that sounds like it would have some, well, pretty obvious and unpleasant signs.
Absolutely. The most unmistakable sign is seeing fecal material or even just gas coming out of the vulva.
Oh, dear.
And as you can imagine, this inevitably leads to chronic infections, constant vaginitis, UTIs, and really severe skin inflammation around the vulva because of that continuous fecal contamination. It's a mess.
Yeah, sounds awful. And treatment for that has to be surgery.
It does. This is purely a surgical problem. It requires very careful surgery to dissect and separate those abnormally connected tracts and then reconstruct the anatomy properly, creating separate functional openings for both the rectum and the vagina vulva. Complex stuff.
Definitely. How about vulvar or vaginal hypoplasia or atresia? That sounds like underdevelopment or maybe even complete absence of parts.
Right. Hypoplasia means underdeveloped, and atresia means absent or closed off. So this is where the vulva itself, or maybe a section of the vagina, is too small or even missing entirely.
Okay.
Probably the most common tactical manifestation described in your sources is something called a recessed vulva. You might also hear it called a juvenile or infantile vulva.
Recessed vulva. What does that look like?
It means the vulva appears small for the animal's size, and it's often kind of sunken or tucked into folds of skin around the perianal area, rather than sitting flush or slightly protruding like normal.
What's the big deal with a recessed vulva if it's just positioned differently?
But the positioning creates a major problem. Urine trapping.
Oh, I see. Like the septa causing pooling.
Similar concept, yes. Because the vulva is recessed, those skin folds around it trap moisture. Urine can trickle back into the area after urination and just sit there.
Leading to irritation.
Exactly. Chronic skin inflammation, that's paravulvar dermatitis plus vaginitis, and often recurrent urinary tract infections because bacteria love that moist environment.
And you'd see the animal licking a lot.
Very commonly, yes. Constant licking at the area because it's itchy and uncomfortable. Now, for complete vaginal atresia, where a whole segment is missing or severely blocked, that's much more critical. You get fluid buildup, severe infections, because there's just no way for anything to drain out.
So for the recessed vulva, is surgery always the answer?
Not always for mild cases. Sometimes really careful hygiene, keeping the area clean and dry, and managing any concurrent obesity can help quite a bit.
Right.
But for more severe recession that's causing chronic recurring infections that just won't clear up, surgery is usually necessary.
And what does that involve?
It's called a vulvoplasty or sometimes a pesioplasty. Essentially, the surgeon removes those excess skin folds around the vulva.
Ah, to reshape it.
Exactly. It reshapes the area to create a more open, normally positioned, outward-facing vulva. This allows for much better drainage and airflow, preventing that urine trapping.
Makes sense. And for the really severe atresia.
That's much more complex. It might require major surgical reconstruction. Or in very severe cases, if breeding isn't a consideration and the complications are significant, spaying might be recommended just to manage the hormonal aspect and prevent uterine complications.
Yeah. Finally, under the congenital umbrella, we have clitoral enlargement or hypertrophy.
Yes, this is simply an abnormally large clitoris. It's noticeable. In some cases, particularly in dogs, it can even contain a small bone, the os clitoridis.
Would an owner notice this easily?
Usually, yes. It might protrude slightly from the vulva, or the animal might lick at it if it's causing irritation.
Is it just an anatomical quirk, or does it mean something else?
It can be just a variation, but the sources point out it can also be a symptom of something else going on.
Like what?
Like maybe an intersex condition where the animal has characteristics of both sexes. Or it could be due to hormonal imbalances.
Hormones again?
Yes, like those caused by conditions such as hyperergenocorticism, Cushing's disease, or even sometimes from administration of steroids for other medical reasons.
So diagnosing this might involve looking for that underlying cause.
Absolutely. A physical exam confirms the enlargement, but the vet might want to investigate further. Blood tests to check hormone levels could be important if there's any suspicion of an underlying endocrine issue.
And treatment.
It really depends on the cause. If there's an underlying hormonal problem, obviously that needs to be addressed first. Surgical reduction of the clitoris itself might be done if it's causing chronic irritation or for cosmetic reasons, but often addressing the root cause is the main goal.
It's quite a range, isn't it? From things that might be completely silent to these really obvious, sometimes distressing problems. Do we have any idea how common these congenital issues are overall?
You know, the exact overall incidence isn't very well documented, partly because, like we said, many can be asymptomatic, especially in pets not used for breeding. You just wouldn't know.
Right.
One study cited in your material did find vaginal septa in a really small percentage, just 0.03% of the total case population they looked at. But that's just one data point.
Okay.
Generally, they're typically identified in younger females, usually under 2 years old. Problems often surface around the time of puberty, their first heat cycle, or maybe when breeding is first attempted. That's when these anatomical issues tend to become apparent. And that can be whether they're spayed or intact.
And is there a genetic link? Could these conditions be inherited?
That's a really good question. A heritable component is suspected for some types, according to the sources, meaning, yes, they might potentially be passed down genetically.
But it's not certain.
The material emphasizes that this is not confirmed with strong scientific evidence at this point. It's more of a suspicion based on observation in certain breeds or lines.
Okay, that's a fantastic overview of the born with it issues. Let's switch gears now. Let's talk about the conditions that develop over time, the acquired lesions. These are problems that crop up after birth, right? Due to various factors.
Exactly. These aren't developmental errors. These result from things like inflammation getting started, infections taking hold, physical trauma, or maybe the development of abnormal growths later in life.
Right. The first acquired issue mentioned is vaginitis. That just means inflammation or infection of the vagina. Correct. Pretty straightforward.
Well, yes and no. Yes, it means inflammation or infection, but it's actually a very broad term covering a multitude of potential causes.
Yeah.
It's not always straightforward to figure out why it's happening.
Ah, okay. So what are some common causes?
Bacterial infections are very, very common, often involving bacteria that normally live in the gut or on the skin, like E. coli or Staphylococcus.
Sure.
But you can also get yeast infections, viral infections. The sources mention canine herpes virus or bovine herpes virus specifically, even chemical irritants, maybe from shampoos or sprays or foreign bodies.
Foreign bodies, like what?
Oh, things like grass-ons, bits of plant material getting stuck up there. Apparently, retained tampons in show dogs used to absorb discharge during heats can be a cause, too.
Wow. Okay.
And importantly, linking back to our earlier discussion, urine pooling due to things like a recessed vulva or maybe urinary incontinence is a super frequent underlying cause of chronic vaginitis.
So a structural problem leads to an acquired infection.
Exactly. It shows how interconnected these things can be. The sources also make a point of highlighting juvenile vaginitis.
Juvenile. So in puppies.
Yes, it's quite common in young puppies before their first heat cycle. They get a bit of discharge, but interestingly, it often resolves completely on its own after they go through puberty and have that first heat.
What signs would an owner typically notice if their animal has vaginitis, besides that juvenile kind?
The absolute hallmark sign is vaginal discharge.
Okay.
But the appearance can vary hugely. It might be thin and clear or whitish, kind of mucoid,
Hmm.
or it could be thick and yellow or green, pus-like, that's purulent. Sometimes it can even be tinged with blood.
Right. Any other signs?
Yes, definitely. Animals will often lick excessively at their vulva because it's irritated. You might also see them scooting their rear end along the ground for the same reason.
Okay. How do vets diagnose vaginitis and figure out the cause?
Diagnosis starts, as always, with a really thorough history and a good physical exam, including looking closely at the vulva and the discharge.
And using that scope again, vaginoscopy.
Vaginoscopy is very helpful here too, yes. It lets the vet see the degree of inflammation inside, check for any foreign bodies that might be hiding, or spot anatomical issues like strictures or that recessed vulva contributing to the problem.
What about lab tests?
Oh, lab tests are crucial. Vaginal cytology is a big one.
Looking at cells.
Exactly. You collect a sample of cells from the vaginal lining, put them on a slide, stain them, and look under the microscope. This helps identify inflammatory cells, bacteria, yeast, maybe even abnormal cells.
Okay.
If infection is suspected, then a bacterial culture and sensitivity test is usually performed.
To know which bacteria and which antibiotic.
Precisely. You grow the bacteria from a swab and test different antibiotics against it to see what will be most effective. And a urinalysis is also key.
To check the urine.
Yes, and ideally collected using a sterile technique like cystocentesis, where you get urine directly from the bladder with a needle. This is really important to rule out or confirm a concurrent urinary tract infection because UTIs and vaginitis very often go hand in hand.
Makes sense. And treatment.
Treatment has to be targeted at the underlying cause you identify. So, antibiotics or antifungals if it's an infection, removing any foreign body, obviously, addressing any anatomical issue surgically, like fixing a recessed vulva, or managing incontinence if that's the trigger.
Got it. Trauma is listed next as an acquired issue.
Yeah.
How does the vagina or vulva typically get injured in animals?
It can happen in several ways, unfortunately. A difficult birth, that dystocia, again, can cause significant tearing, lacerations, and bruising to the vaginal walls and vulva.
Ouch.
Injuries can also happen during breeding, especially if there's a big size mismatch between the male and female. The male can cause trauma.
Right.
Animals might also cause self-trauma from just excessive licking or scooting if they have some other underlying irritation. And one point that really stood out in the sources, particularly for cattle,
Yes.
was horn injuries. Cattle can actually injure each other's vulvar or vaginal area with their horns.
Wow, I hadn't even considered that. What are the results of that kind of trauma and how is it treated?
Well, trauma can result in pretty painful lacerations, bleeding, significant swelling, and always a risk of secondary infection getting into those damaged tissues.
Yeah.
Treatment involves, first off, managing the pain, then often antibiotics to prevent or treat infection. Careful cleaning of any wounds is essential. And if the injuries are severe or extensive, surgical repair might be needed to stitch things back together.
Okay. Now let's talk about vaginal prolapse and hyperplasia. These sound kind of similar, and the sources say they're common during certain hormonal times.
They are very much linked to hormones, specifically estrogen. You almost always see these in intact, unspayed female dogs and cattle, typically during the proestrus or estrus phases of their heat cycle.
When estrogen levels are really high.
Exactly, that's the trigger.
How are they different, though? Because I feel like people sometimes use those terms, prolapse and hyperplasia, almost interchangeably.
That's a really good point, and they are different. Hyperplasia is essentially an exaggerated swelling and thickening of the vaginal lining itself, the mucosa, in response to that estrogen surge. The tissue gets really thick and bulky and edematous, and it can actually protrude out from the vulva. The sources describe it often looking like a pink, swollen donut, or sometimes a fan shape emerging from the vulva.
The donut, okay, and prolapse.
Prolapse is generally more severe. That's when the entire vaginal wall, sometimes even including part of the cervix or uterus, actually turns inside out and protrudes through the vulvar opening.
Whoa.
This can also happen during a difficult birth due to excessive straining, or sometimes from straining caused by other issues like constipation or urinary blockage, but the estrogen link during heat is very common for dogs.
What signs would an owner see then, besides maybe a donut?
Well, the most obvious sign for either condition is seeing a mass of pinkish or reddish tissue sticking out from the vulva.
Right.
And that exposed tissue is really vulnerable. It can easily become dry, irritated, damaged, ulcerated from rubbing, or secondarily infected.
And can it cause other problems?
Yes, if it's large enough, a big prolapse or severe hyperplasia can put pressure on the urethra, making it difficult or painful to urinate. Or it might press on the rectum and interfere with defecation.
So how are these treated?
For mild vaginal hyperplasia, sometimes conservative management is enough. That means keeping the exposed tissue clean, maybe using lubricants to prevent drying, sometimes applying topical treatments. Often it might shrink back down on its own after the heat cycle ends and estrogen levels drop.
Okay.
However, for severe hyperplasia or for any degree of true prolapse, surgical intervention is usually required.
What does that involve?
It typically involves carefully cleaning the exposed tissue, trying to reduce any swelling, sometimes using things like sugar paste or hypertonic saline, and then manually pushing it back into place, maybe holding it there with temporary sutures. Sometimes, if the tissue is too damaged or swollen, part of it might need to be surgically removed, resected.
And how do you stop it from happening again next heat cycle?
That's the key point. And here's a really important takeaway from the sources. Ovariohysterectomy, or spaying, is the definitive treatment to prevent recurrence for both hormone-driven hyperplasia and prolapse.
Because it removes the estrogen source.
Exactly. No more estrogen surge, no more trigger for the swelling or prolapse. So spaying is very often recommended, either during the surgical correction or shortly after, if the animal isn't intended for breeding.
Right, that makes complete sense. Okay, the last acquired condition on our list is vaginal and vulvar tumors, or neoplasia actual growths.
Yes, and these are clinically pretty significant. The sources highlight a statistic that really caught my eye. Vaginal and vulvar tumors are the second most common type of tumor in the entire female reproductive tract in dogs.
Second most common, wow. After mammary tumors, I assume.
That's right after mammary tumors.
That's more common than I would have guessed. How often are they, the bad kind,
Yeah.
malignant?
Well, here's some relatively good news on that front. In dogs, a really high percentage, the sources quote, figures ranging from 73% up to 94% are actually benign.
Oh, that is good news. Benign meaning not cancerous, they don't spread.
Correct. They grow locally, but don't typically metastasize to other parts of the body.
So what are the most common benign types then?
By far, the most frequently seen benign type is the leiomyoma.
Leiomyoma, what's that?
These arise from the smooth muscle tissue that's normally found within the vaginal wall. And importantly, just like hyperplasia and prolapse, they're very often hormone dependent.
Estrogen again.
Estrogen again. They tend to grow under the influence of estrogen in intact females. Other benign types that get mentioned include fibromas, from fibrous tissue, and lipomas, from fatty tissue.
Okay, and what about the malignant types? The less common but more serious ones.
Right. The malignant ones are less frequent, but obviously carry a worse prognosis. The sources specifically mention one called the transmissible venereal tumor, or TVT.
Transmissible, as in contagious.
Yes, exactly. This one is unique because it's actually contagious between dogs, primarily spread during mating. The tumor cells themselves are transferred. It often looks kind of like a fleshy, reddish, cauliflower-like mass.
Wow. Okay, what other malignant types?
Others mentioned include squamous cell carcinoma, which arises from the surface lining cells, and adenocarcinoma from glandular cells. These behave more like typical cancers, potentially invading local tissues and spreading.
What signs would an owner notice if their dog had a vaginal tumor, benign or malignant?
Often, an owner might actually see a mass protruding from the vulva, especially if it gets large. Or they might feel something abnormal if it's located closer to the opening.
Any other signs?
Bloody discharge unrelated to the heat cycle is another very common symptom associated with vaginal tumors.
Okay.
Depending on the tumor size and exact location, it could also cause straining, difficulty urinating, or defecating if it's pressing on things, or it might interfere with breeding attempts.
Yeah, and are these seen more in older dogs?
Generally, yes, except for the TVT, which can certainly affect younger sexually active animals because of how it's spread. Most other vaginal tumors are typically diagnosed in middle-aged to older dogs, often around 10 years of age or so.
So if a vet finds a mass, how do they know for sure what type it is? Whether it's benign or malignant?
Well, a physical exam and vaginoscopy allow the vet to see the mass, assess its size, location, and general appearance. But the absolutely crucial step to get a definitive diagnosis to know exactly what type of tumor it is and whether it's benign or malignant is a biopsy and histopathology.
Taking a piece and sending it to the lab.
Precisely. Taking a tissue sample of the mass and sending it to a specialized veterinary pathologist who examines it under a microscope. That's the gold standard. Imaging, like ultrasound or x-rays, might also be used beforehand to get a better idea of the tumor's extent, where it's attached, and potentially to check for any signs of spread in cases suspected to be malignant.
Okay. And how are these tumors treated?
The primary treatment for most vaginal tumors, especially the benign ones like leiomyomas, is surgical removal.
Cut it out.
Cut it out. And this is very often combined with spaying, ovariohysterectomy, at the same time.
Why spay as well?
Particularly for those hormone-dependent benign tumors like the leiomyomas, spaying removes that hormonal stimulus. It helps prevent the tumor from recurring and stops new ones from forming. It's often recommended even if the tumor itself isn't obviously hormone-linked. Just as good practice when doing surgery in that area on an older, non-breeding female.
Right. What about the TVT, the transmissible one?
For the transmissible venereal tumor, the sources highlight something really important. Chemotherapy is highly effective.
Chemo works well for that one.
Yes, certain chemotherapy drugs are often curative for TVT. It responds very well. Radiation therapy might be considered as an option for some other malignant tumors, perhaps ones that are difficult to remove completely with surgery, or as an additional treatment after surgery.
And the outcome, the prognosis, really depends heavily on whether it's benign or malignant.
Absolutely. The prognosis for benign tumors like leiomyomas after complete surgical removal is generally very good. The animal usually does very well.
That's great.
For malignant tumors, however, the prognosis is much more guarded. It really depends on the specific type of cancer, how aggressive it is, its size and location, whether it was completely removed, and critically, whether it has already spread, metastasized at the time of diagnosis.
Wow. Okay. That's an incredible array of issues, both congenital and acquired, that can affect this area. So with so many possibilities, septa, fistulas, infections, hyperplasia, tumors, how does a vet actually piece it all together? What's involved in that diagnostic detective work?
It really is like detective work. It's a systematic process, kind of like putting together a complex puzzle. And it always starts with the essential groundwork, getting a thorough history from the owner.
Asking lots of questions.
Loads of questions. The vet needs to know the animal's age, breed, whether they're spayed or intact, if they've ever had litters or calves before, and then really detail information about the signs you, the owner, are seeing.
Like what specifically?
Well, like when did the signs start? What exactly does any discharge look like? Color, consistency, amount, how often are they licking? Is there any straining to urinate or defecate? When was a mass first noticed? Is it only present during the heat cycle? All those details are crucial clues.
And then comes the physical exam.
Yes, absolutely. A general physical exam first, just to assess the animal's overall health, including palpating the abdomen carefully. But then the key is a really focused examination of the vulva itself and the surrounding perineal area.
Looking for obvious abnormalities.
Exactly. Swelling, discharge, skin irritation, visible masses.
And getting a closer look inside.
Right. This is where this specialized vaginal examination comes in. This includes visually inspecting the external vulva and any discharge very closely. Then, digital palpation if the animal is large enough and it's feasible, carefully inserting a lubricated, gloved finger to feel for any masses, narrowings, or irregularities inside the vaginal canal.
And the scope.
And most importantly, vaginoscopy. Using that specialized scope, as we've discussed, allows direct visualization of the entire vaginal canal lining.
What can you see with that?
You can see the color and texture of the lining. Is it red and inflamed? Are there ulcers? You can identify physical structures like strictures or septa. You can locate foreign bodies that might be lodged there. You can see exactly where discharge might be coming from, maybe the cervix. You can visualize tumors. It's invaluable.
Do they need sedation for that?
Sometimes, yes. Depending on the animal's temperament and the type of scope used, sedation or even light anesthesia might be needed to do a thorough and comfortable examination. The sources also mention that sometimes gently inflating the vagina with a bit of air or sterile saline during the procedure can help distend the walls and improve visualization.
Okay. What about lab tests? You mentioned cytology and culture earlier.
Yes, lab tests are absolutely vital pieces of the puzzle. Vaginal cytology, as we said, looking at the cells under a microscope, is huge. It helps determine if the problem is primarily inflammatory, if there's evidence of infection, bacteria, yeast, if the cells look abnormal suggesting a tumor, or even sometimes reflecting the stage of the heat cycle.
Right.
If infection is suspected based on the cytology or clinical signs, then bacterial culture and sensitivity is done. You take a sterile swab, send it off to grow the bacteria, identify them, and see which antibiotics will kill them.
And the urinalysis.
It's still important.
Critically important. A urinalysis, ideally from that sterile cystocentesis sample, is essential to rule out or diagnose a concurrent urinary tract infection. They're so often linked, you really have to check both systems.
Okay, any other tests? Basic blood work is often done to assess the animal's overall health. Look for signs of systemic infection or inflammation. Check kidney function before anesthesia, maybe. Or check hormone levels if an underlying endocrine issue like Cushing's is suspected. And for breeding animals experiencing reproductive issues or discharge, brucellosis testing might be included in the workup, as that's an important infectious cause of reproductive problems.
You mentioned imaging earlier, too, like the contrast vaginography for blockages. How else is imaging used in these cases?
Abdominal ultrasound is really helpful, particularly for looking at the structures beyond what the vaginoscope can easily reach: the upper part of the vagina, the cervix, and the uterus.
What can ultrasound show there?
It can identify fluid accumulation in the uterus, like pyometra, or find masses in the upper vagina or cervix. The sources specifically note a useful technique: infusing sterile saline into the vagina during the ultrasound exam.
Why do that?
It helps separate the vaginal walls, making them easier to visualize and allowing the ultrasonographer to better identify thickening, masses, or other lesions within the wall itself. It's a neat trick.
Yeah. What about regular x-rays?
Standard radiography or x-rays can sometimes show uterine enlargement if it's significant, or they might help rule out other problems in the area, like bladder stones that could be contributing to straining or urinary signs. And as we discussed, contrast vaginography using that dye is really the superb technique for outlining the internal structure of the vagina itself and detecting blockages, narrowings, or abnormal connections like fistulas.
And for really tricky cases.
For highly complex situations, maybe planning a difficult surgery for a tumor or complicated fistula,
Right.
advanced imaging like CT scans or MRI might be used to get really detailed anatomical information.
And getting that definitive answer, especially when you see a mass.
That comes back to the biopsy and histopathology. Taking that tissue sample, whether it's a small piece during vaginoscopy or a larger piece during surgery, and having a veterinary pathologist examine it microscopically is the gold standard. That's how you definitively determine the exact nature of a mass or a complex lesion. Is it just inflammation? Is it a specific developmental defect? Is it a benign tumor? Or is it a malignant tumor? That pathological diagnosis is key to guiding treatment and predicting the outcome.
Okay, so once the vet has done all that detective work and hopefully confirmed a diagnosis, what are the typical ways they go about fixing these problems? What do the treatment approaches generally look like?
Well, as you can probably guess by now, treatment really varies dramatically. It totally depends on the specific condition, how severe it is, and whether it's one of those congenital issues or something acquired later.
Right.
For some of the simpler inflammatory issues, like maybe a mild case of juvenile vaginitis or a bacterial infection caught early, medical management might be enough.
Like hygiene and antibiotics.
Exactly. Things like antiseptic douches or wipes, maybe systemic antibiotics based on those culture and sensitivity results we talked about, perhaps anti-inflammatories.
But for the structural problems, the malformations or the tumors, it sounds like surgery is often going to be needed.
Yes, for many of these conditions, surgery is frequently required. That's really the mainstay for dealing with physical abnormalities.
Like what kinds of surgery?
Well, it could involve surgically cutting out those septa or bands that are causing blockages, repairing those rectovaginal fistulas, which is complex reconstruction, performing that vulvoplasty surgery to correct a recessed vulva and stop the urine trapping, surgically removing tumors, obviously, or procedures to correct a vaginal prolapse, maybe involving replacing the tissue and suturing, or sometimes resection if needed.
And we've circled back to spaying quite a few times throughout this. Remind us again, what's its role in the treatment plan?
It plays a really significant role in many cases. Ovariohysterectomy, or spaying, is very often performed either in conjunction with the primary surgery or as a key part of the overall treatment strategy, especially when future breeding isn't a priority for the animal.
Why is it so often recommended?
Primarily because it's crucial for those hormone-dependent conditions we discussed: the vaginal hyperplasia, the prolapse, and those very common benign leiomyomas. Removing the ovaries takes away the source of estrogen that drives those problems or makes them grow. It's often the definitive cure or prevention for recurrence.
Yeah.
It's also often recommended for animals with severe congenital issues that are causing chronic, difficult-to-manage problems. Spaying can sometimes simplify management by eliminating any potential hormonal influence on the vaginal tract and preventing complications like pyometra down the road.
Makes sense.
Yeah.
What about treatments other than surgery for tumors? You mentioned chemo for TVT.
Right. As we noted, chemotherapy is remarkably effective, often curative, for the transmissible venereal tumor. That's a huge success story for veterinary oncology.
Yeah.
Radiation therapy might also be considered as an option for certain other malignant tumors, perhaps ones that couldn't be completely removed surgically, or to help provide additional local control after surgery.
Are there particular challenges with treating some of these conditions effectively? I think the sources mentioned manual dilation for stenosis having variable success.
That's right. Simply attempting to manually stretch or break down vaginal narrowings, stenosis, or fibrous septa can have pretty variable results. It might work for very thin membranes, but often they just scar back down. And
Uh,
the sources do note that even with surgical resection, and sometimes using medications like corticosteroids afterwards to try and prevent scar tissue from reforming, there can unfortunately be quite high recurrence rates for some forms of vaginal narrowing or stenosis. They can be frustratingly difficult to fix permanently sometimes.
so, given all that, what's the overall expected outcome, the prognosis, for animals diagnosed with these various conditions?
It really depends heavily on the specific diagnosis and how severe it is.
A wide range, then.
A very wide range. For relatively straightforward issues, like maybe a thin septum that's easily removed, or a small benign tumor like a leiomyoma that's completely excised along with spaying, the prognosis is often fair to good. You expect resolution of the clinical signs and a significant improvement in the animal's comfort and quality of life.
That's good.
However, for the more severe end of the spectrum, severe congenital malformations like complete vaginal atresia, extensive rectovaginal fistulas that are hard to repair perfectly, or malignant tumors that are invasive, difficult to remove completely, or have already spread, then the prognosis can be much more guarded, even poor.
Guarded both for fixing the problem and for future breeding.
Yes, guarded both for complete resolution of the clinical problem and potentially for preserving reproductive function, if that was a goal.
And if these conditions aren't treated effectively, or maybe they just don't respond well to treatment, what are the potential long-term complications?
That's when you tend to see chronic, ongoing problems. These can include persistent, smoldering vaginitis that never fully clears up. Recurrent, hard-to-treat urinary tract infections become a major issue. If the animal is used for breeding, difficulties conceiving or carrying a pregnancy, or experiencing dystocia, difficult birth, during delivery are significant risks. And in some complex cases, particularly those involving nerve damage or severe anatomical distortion, urinary incontinence could even become a long-term complication.
Okay. And lastly, prevention. Can any of these conditions actually be prevented?
Well, for the congenital issues, the ones they're born with, since a clear inheritance pattern isn't firmly established for most of them, according to these sources, definitive prevention through selective breeding is pretty challenging based on this material alone. You'd need more evidence.
So what are the recommendations then?
Recommendations often center more on managing the condition in the affected individual to prevent secondary problems like infections, or perhaps considering spaying affected animals to take them out of the breeding pool if a genetic link is suspected in a particular line or breed, and certainly to manage their own health.
So not much primary prevention.
The most emphasized form of prevention that really comes through in the discussion is actually early diagnosis and appropriate intervention.
Catching it early.
Exactly. Catching these problems as early as possible before severe secondary infections set in, before irreversible scarring or damage occurs, that's the best way to manage them effectively and prevent those serious long-term complications we just talked about. Early action is key.
Wow. That truly was a deep dive, wasn't it? Into a really fascinating and honestly quite complex area of animal health. We've journeyed all the way from issues that arise during that incredibly intricate process of embryonic development.
Yeah, things like septa and fistulas, where the basic plumbing didn't quite come together right.
All the way to problems that crop up much later in life, due to things like infection or trauma or those growths like hyperplasia and tumors.
And we've really seen how veterinarians employ this skilled combination of careful history-taking, thorough physical exams, those crucial imaging techniques like ultrasound and contrast vaginography.
And the vital lab work like cytology, culture, and ultimately biopsy, to really uncover exactly what's going on beneath the surface, which isn't always obvious from the outside.
Definitely not.
We also explored that whole range of medical and surgical interventions that are available, highlighting that surgery is often really key for the structural issues in tumors, and emphasizing that significant role that spaying can play, both in treating current problems and preventing the recurrence of many of those hormone-linked or chronic issues.
What really stands out for me after digging into these sources is how seemingly common or maybe non as specific signs in an animal, things like just a bit of discharge or maybe excessive licking back there.
Yeah, things you might almost ignore.
Right. How those signs can actually be indicators of such an incredibly wide spectrum of underlying problems.
Mm.
Some might be relatively minor, easily fixed, but others can be quite serious and potentially life-altering for the animal.
It really drives home the point, doesn't it? That paying close attention to even subtle signs like that and seeking prompt veterinary diagnosis and the right treatment based on that diagnosis is just absolutely crucial, not just for resolving the issue, but for the animal's basic comfort and their overall health and well-being.
Absolutely. And, thinking about that incredibly delicate and precise dance of embryonic development that has to occur, all those cells migrating, fusing, forming tubes for everything to end up just right.
Yeah.
Isn't it kind of remarkable to consider all the potential points along that pathway where things could just slightly deviate, maybe one little signal goes wrong, leading to those congenital malformations we discussed?
It is amazing. It works correctly most of the time.
It really is. And then on the flip side, thinking about how the body later responds to challenges, to injury, to infection, even to its own normal hormonal signals during a heat cycle, how those responses can sometimes go into overdrive or lead to problems like hyperplasia or inflammation.
Yeah.
It truly underscores the immense complexity of these biological systems, and it highlights why that veterinary expertise, that ability to diagnose and manage these often hidden issues, is just so fundamentally important.
It really does. After diving into all of this today, what does it make you think about the hidden complexities of animal health?